Zara,
Good
you've been
morning.
supporting women for many, many years in the UK.
I have, yes. I am a doula. I trained with Developing Doulas in 2011 and have been working full-time as a doula since then.
You were actually my teacher in
I was.
2016 when I did my second doula course in the UK.
You were my first cohort of doula trainees. Yeah, so that was 10 years ago this month.
Yeah. And thinking about you supporting women, you support me a lot in my career. You gave me such a good base on understanding my role and
Yes.
understanding me and how we can better support women. So I just want to highlight how important you are. Like, you were not just my teacher and become my friend, but you actually mentored me for many years, and it's so grateful to now say that you're actually my friend, but you're still mentoring me. Because
Yeah.
what you do, it's truly inspiring, and I respect Developing Doulas a lot and what Madi does for all of us. So I would love you to explain, like, who are Developing Doulas? What do we do? What do I do? What do you do? As a community, because we are a beautiful community.
A really beautiful community. Yeah, so that's a really good question. So Developing Doulas was founded by Linda Quinn and Maddie McMahon. Linda is now in her 80s. She had been a doula from her teens. She was Maddie's mentor when Maddie first became a doula 24 years ago. And Maddie had been a teacher. So Linda thought, right, this is the person I want to launch a doula training with, because she can create the content. She'll know how to engage people in the course and, you know, facilitate a really great learning environment. So they came together and they launched Developing Doulas in 2008. We're now still going, still training hundreds of doulas a year, both virtually, so we can connect with people around the world and across the UK, you know, in and across the UK, in Surrey, Manchester, London. So, you know, we cover all the bases. So we have an amazing community of doulas.
And as a doula, that's what I learned.
Yeah.
I want your view in terms of moving fast forward, starting 2008.
Yeah.
And now 2026. Let's talk childbirth.
Childbirth.
Of course, like, just from where I sat, I can see the amount of women needing more and more and more the support of a doula. So what is a doula? And our role supporting women that are preparing to not just give birth, but becoming a mother.
Yeah, that's such a good question. The word doula actually means to serve women. It is a unique role, it really is, which is why we so need the community once we do our kind of initial preparation course, because you need to have somebody there to kind of hold your hand through it, to doula you through as you take your first steps into kind of becoming a doula yourself. So doulas offer practical, emotional, informational and social support. And we tend to be privately hired by our clients. So our focus and energy is directed always at supporting their choices. So where we are really different is that we have no agenda. So we're not going to tell our clients what to do. We are going to make sure that they have all the information so that they can make an informed choice. We also don't judge those decisions. Yeah. So a large part of doula training is to work through any personal experiences that we might have had of raising our children, of being around children, you know, infant feeding, things like that, that can really trigger people, because when we go out to doula, we have to clean slate. Whatever feels right for you, we will support. And we know that, you know, a lot of people might have family and friends as part of their support network, but they're very emotionally invested. So whilst doulas also are, we are slightly set back. And that means that, you know, we find that women can really open up and share. Doulas don't try and fix. So, you know, a mum might say, this is hard, breastfeeding's hard, I'm tired. And, you know, a partner might say, give your baby a bottle. I can do that. You can rest. But a doula will let that woman release what's going on. And very often that's all that's needed. That kind of safe space to to talk and release the sort of feelings that are holding them back. And often then they can breathe. Okay, let's reset and find a way to move forward with this.
You just sit there and hold that space.
Yeah.
I love what you said, that we don't have an agenda.
Yeah.
When we sit with women, we really look at you as an individual.
Absolutely.
Of course, we come from different backgrounds. Like we have doulas comes with different academic backgrounds, or doulas that are just become a mother and learn something and decide to support women, but coming without an agenda. Because you just mentioned that we come without an agenda.
It's absolutely
for me. It's
key.
very beautiful, because that when you just sit in front of a woman and understand that we all come from different backgrounds, different needs as an individual. There is a huge impact, a cultural impact that it plays a role. And I don't know, in many cultures, that when they actually have the family getting involved, and there is a need of someone
impartial.
Exactly. And how, considering all of this no agenda, we can still guide that women and give that women confidence. How do you see that? Like when we considering all those things as your role, my role, and you obviously you're very knowledgeable, how can you actually still sit back and give confidence to that woman in a way that you know you're going to make a positive impact on the day that she's becoming a mother? Let's talk about the birth itself. And then
I think, a large part of what's so wonderful about the doula role is when we are employed by our clients, very often it's maybe 4 or 5 months into the pregnancy. So oftentimes we'll have many, many conversations, many opportunities to sit and build a relationship. And the doula role is built on trust. It is, I've got your back, no matter what happens. And that doesn't need to be actively doing things. It can just be that sense that you have somebody there that is there for you.
I got your back.
I've got your back. Yeah.
Why? We know there is a massive need of that more and more.
Yeah.
For obvious reasons. And I personally, I love to focus on what is positive.
Yeah, I know,
right?
You do. Yeah.
We don't want to. I personally feel like I'm not gonna sit here and talk about all the things that I know that can go wrong. It doesn't give the tone of like I'm empowering you.
Yeah. Yes.
But we are living a moment now that the word, it is a bit over medicalized.
Yeah.
But we do need the medical team, don't we?
Yeah.
We need the wonderful midwives.
Yeah.
We need the wonderful doctors.
Yeah.
The hospitals, the birth centers, the home birth teams. And why, my point is like, how you can empower women without the need of explaining so much about the things that can go wrong, like risk assessment. Because there is a massive noise.
There is, and I think they get enough of that through the midwives and obstetricians that offer them care. So as a doula, when we prepare them antenatally, we are going to go through all of the options. And I think it's also decoding a lot of the language that's used medically. Let's break this down. What does it mean? Because, a client might have an appointment and they're 40 weeks pregnant and they'll be told, right, we're just going to book you in for an induction. So, okay, let's rewind a little bit. What does that mean? Are you at risk? Is your baby well? Are you well? In that case, you don't have to have an induction. So I think you're right in saying that there are so many medical interventions that are necessary. They can save lives, and that's really important.
Yeah.
But there now is a culture that intervention happens more and more frequently, and not necessarily for the right reasons. So as doulas, we can say, look, okay, these are questions to ask. Let's just explain in plain English what my risks are.
Yeah.
And then you can actually make a decision that feels right, rather than making decisions based on fear. And that is what we see so often. I'm going to have an induction because they've told me my baby's going to die. that is not helpful.
The language also.
The language is so important. And as doulas, that's something we're acutely aware of, that we're holding our clients and explaining things in a way that's the clear and not triggering, that's
fear of childbirth.
Yeah.
And becoming a mother and not knowing.
Exactly.
Years and years and years of being brainwashed.
Yeah. The culture is that we need hospitals, we need medical management, that women aren't capable of birthing our babies without these interventions. And, it's a system. It's all about risk, and they want women to come in, have their babies safely and move them on.
I love that. I often said there is no path that you're going to choose that it's zero risk.
There is always a
risk, right? Like
exactly.
everyday life, there is a risk. And how am I going to feel confident to choose what is best?
And also
for me,
some women will say, if I'm told there's a slight risk of anything happening, I choose to take no risk at all. So I will follow the advice that I'm given from the healthcare professionals. And other people are like, I trust my body. I feel in my gut that things are okay. So I choose to listen to that. And as a doula, we will say, you get to change your mind at any point. If you suddenly say, today, I'm 41 weeks, I feel like I need to or want to have an induction.
Yeah.
Sure. I will come with you. Let's make your environment as comfortable as possible. Let's make sure that you feel held and heard, and not forgetting the partners, because very often they're like rabbits in the headlights. They really have very little idea about what's going on. So often it's about making sure they're okay.
Understanding their needs.
Supporting them. So the mother and baby at the centre, the partner has their arms around mother and baby, and then we come in and we've got them all. And that layer of continuous support is so important, because we don't change shifts. We're there as, we are with them on that journey.
Do you know one thing that I love about you, and I learn because of you? It can be quite controversial when I say, I don't think I'm necessary. I don't think I am essential, especially when it comes to birth, being very honest with you. But I understand the need, especially on these days. Like, now talking about the need is like women's need. And how do you prepare the woman to understanding her needs, right? Which she wants you, because you provide that continuity of care. You make her feel safe. You understand her as a person.
Absolutely.
So I believe all they need is to feel safe, to labor and have a positive birth and positive postnatal. But there are lots of controversial things at the moment. Why I'm saying that? Because I always like to give the good impressions for the doctors, because I personally work with doctors all my career.
Yes, you have.
And then there are boundaries, right? And how important is to learn that we don't cross the boundaries. We don't give clinical advice. We are not there to tell women what to do. It's not in my role to arrive in the hospital or the environment that she chooses to give birth and tell what are her needs, but help her to understand her needs and remind her that if she understood, if she feels safe, how do you see this? And how do you to play around that? And do you think you always see yourself as essential? Like how?
Absolutely not. I mean, there are almost the sort of perfect situation is if you are just sat really quietly in the corner, and as you say, it's that sense of trust. That mother might be labouring, open her eyes, there you are, you're knitting, reading, just quietly there, and that feeling of safety. We all know it, don't we? If you're ever sort of feeling anxious, and then, someone that you love and trust puts their arm around you, calm, it's all good. That feeling is so important in the birth space. It's critical. So, we're called doulas. Sometimes we will do. Sometimes they'll reach out and need a hand or some massage, or just some affirmations. You've got this, cheerleading that mother. But very often, we will step away, and that is something that we, for many doulas, is something that we really have to learn, that feeling and ability to be zen and quiet and not feel like we're not doing enough, because that can be counterproductive.
Yeah.
You know, if you're sort of fiddling around and trying to make yourself look busy.
Yeah.
So we learn every birth we attend.
Yeah. We spoke, I think it was yesterday, right? Like, I remember when I first started to attend births, I have a bag that we call like doula bags.
Yeah.
And you would arrive with a bag full of stuff that you feel the need of doing it. And I'm like, I don't have a bag.
Yeah.
I truly don't have a bag. And because you understand more of the need of just being you and your presence. Let's just share one experience.
Yeah.
I don't like to tell people's birth stories, but that's my story from my side. How I can benefit women from what we do. And you share one.
Okay.
So because I'm new to Dubai in terms of like, I'm like now, resident and living here, but I attend a few births and I have a little bit of experience here, but I officially attend as a resident and working here my first birth a few weeks ago. And the beauty of that birth is like, it was never in the plan for me to attend that birth. But I was working with someone, I met her, she was 7 weeks. She was interested on the gentle birth method.
Yeah.
She followed the whole program. I'm a gentle birth method practitioner. She was really committed with the whole program.
Brilliant.
And it was literally maybe 2 weeks before her due date that she came to one of our appointments with her mother, with her husband. It was very obvious that we established that trust, continuity relationship throughout her whole pregnancy. And the way I felt was like, they invite me to come to the birth. And now I feel like there is always the right birth for me to attend.
Yeah.
And I was like, oh, this is very precious, because I feel like I was invited for the most special birthday party here.
Yeah, absolutely.
And it felt natural to say yes. But I knew she doesn't really need me, because she was so well prepared. She was so confident, and her husband so really engaged, and even the whole family.
Yeah.
But it felt right for some reason, okay? Why I'm saying that? Because the image that I have is like, she went in spontaneous labor, things progressed in a very natural, physiological, amazing way, quite fast.
Yeah.
And, sometimes you make a plan that I'm going to their house when they are laboring and we might transfer together, or you are open to change, like last minute, I meet you at the hospital. That was the case. Like I was going to the house and then the husband, like, let's go to the hospital because things are changing and she feels like she wants to go now. Yeah. Okay, so I arrived at the hospital. I opened the door of the room. And I saw her, that body language, that breathing, that face. And she did this. How she recognized me. And that smile, that it felt, this is not about me, but I understood my role. What I know now, because she told me that she immediately connect somehow with our preparation when I was always telling her to take your mind to that place safe, take a deep breath in and out, drive, something that I do.
Yes, yeah.
And the image that I have, I didn't do anything other than just stay still in that very quiet room. But in her, like that continuity of care.
That's right.
Does it make sense what I'm saying? Like, am I explaining what she understood all.
She did, absolutely.
She did, like, her confidence was like, somehow we give confidence for women without saying anything, because she was so well prepared.
But you brought that confidence
throughout
into the space.
Yeah, exactly.
So that kind of memory, like the hypnobirthing, the affirmation,
the touch, the
oils,
the husband getting engaged, and
I think that's the thing, that actually sometimes the role of the doula is so, you can't put your finger on it, because in a way you can't learn to be a doula. It's vocational. It's in there. So that is a beautiful example of you being exactly what you needed and that family needed at every step.
Can you give me one example? I mean, I know you have, I don't know, over whatever numbers, but if you have to highlight one as a doula, when you like, I understood my role here as a woman, as a doula, and you think, you know.
Okay, so I think back to a home birth is an option in the UK. And it was a client that I had supported for her first birth, and she had had a cesarean because her baby was in a suboptimal position. So this time they planned a home birth with a birth pool. We had done a lot of preparation, a lot of the gentle birth preparation. She had ordered a lot of the herbs and teas, and we'd done a lot of creative healing massage. So she was well prepared, but having a VBAC, as we call it, a vaginal birth after cesarean, you know, there's a sort of a high probability that you will get the birth you want, but, you know, there's still some sort of risk there. And I remember it was the most beautiful birth that I've seen unfold. I arrived, her husband was there, her sister was there, her mother was there. You know, some people need as few people as possible in that space, but she has a very close relationship with her family. And so it just felt right for her mother to drift in.
Family event.
Yeah, but everyone was respectful. It was calm, it was quiet. She used a bit of gas and air, and I think she had her baby in 6 hours. So she got into the pool. She breathed her baby out. It was one of those really beautiful births that, you know, some people have. And it's not because she worked harder that she got that birth. It's a physiological thing.
Yeah.
You know, her body and her baby were aligned. The baby was in a great position.
Yeah.
And yeah, just watching that baby swim out into the pool.
Swim out.
Yeah, that always remains one of my favourite births. And I've seen a lot of those births, but obviously a lot don't follow that path. And, you know, as doulas, we plan with our clients to have plan B, plan C. So we've got to plan whatever happens.
And how beautiful the journey.
Yeah.
It's like, even if you don't end up having the birth that you plan, it's a journey, isn't it?
It's a journey.
And how much you learn about yourself.
And the intention that you put into the planning, that, that, you know, that this is the way it's got to be now. So we can confidently step into this because we've made a plan.
You just made me think about, because a few years ago back in the UK, I had people questioning me, clients, do you only attend home births? Like, no, because I want to have a cesarean.
Yeah.
And they also need the support. We're all about options. I think it's very important to talk about these things, because of course, we're trying to normalize childbirth. There is such a culture thing that, right, natural birth or physiological birth, it's becoming somehow rare.
But I think you're absolutely right. And doulas will support any kind of birth. More and more doulas are supporting elective cesareans because more women are choosing to have them. But there are also times where you sit and you do your preparation and something lands with the client and they think, actually, I want to birth at home. I suddenly have more information to trust my body. So our job isn't to say, you need to have a home birth, you need to birth vaginally, that's best. Our job is to say, here's the information. It's like, choose what feels right for you. And also, you can change your mind, as I said before. If you suddenly think, actually, this is now what I need and my baby needs, we're there to support you through that.
I love that. Just one more thing, because we mentioned, in your example, your client was following the gentle birth method.
Yeah.
She was doing all the oils, the visualization, the teas. Do you think it's a coincidence how well they do when they are actually following the program?
No, I don't. I mean, because it was a classic, straightforward birth. And I mean, she followed it particularly around the diet as well, and cutting out gluten and things like that. And, used an epino and she had no tearing. So, you think there must be something in it.
Yeah. I mean, because recently I actually spoke with Dr. Gori, and she was like, we prove a point, right? And I was like, it always breaks my heart when she says that, because I feel like you don't have to prove a point. For me, you were a genius. You were a childbirth pioneer. You started 30 years ago. You were an obstetrician working in a busy NHS hospital, and you identify something that for me is like, I keep saying this to Dr. Gori, you have a formula.
Yeah.
You look into women's lifestyle. And for me as a doula, that came like how I put those things together, because there is a need of looking into women's lifestyle. How do you eat? How do you move? What do you believe? Other supplements that you're taking. I'm not giving clinical advice, but now I understand more of the Western and Eastern approach, how she combined and studied homeopathic remedies, and from her culture, like the Ayurvedic medicines and oils, it's all natural, and how women can benefit. And the amazing hypnobirthing and visualizations and techniques where you give women their knowledge. You are learning about your body. You are learning how to control your emotions. You are learning how to surrender. Combining all, I personally don't think that is a coincidence. You see what you said. She gave birth in 6 hours. Dr. Gori always say our women will give birth between 4 and 6 hours. And when I think about the births that I study, I don't like to put pressure on women and say it has to be fast.
No.
But now I don't think it's a coincidence that labor is straightforward. They manage to actually sleep if they are in early labor. They have the emotional control. They are so physically and mentally
well,
prepare, and they feel well, they feel confident. You enhance their health.
I absolutely agree. And I think, having that information about their personality types and their lives and their relationship with their partner, all of these things are huge. But sometimes we have to acknowledge that we take information and they won't listen. And we also have to say, that's fine. I'm still here to support you. But when you see that investment, that real investment, that's a beautiful thing. But also acknowledging that for some people, they just don't have the time, the bandwidth, the money. So it's bringing little snippets of it.
I love that you said that, because sometimes many people don't have the money and the time to commit. But many people has access to one tool, that is visualization. We really, like, if you talk with Dr. Gori and our office back in London, like how many people actually has access to her audios?
Because they're on the website, aren't they? You can download.
And you can download, and it's very affordable. And they never met Dr. Gori, they never met the team, and they send the birth stories and how positive it is.
That's
and with that comes their knowledge of their lifestyle. What do we eat? What do you take? What do you la 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 la?
So absolutely. So that's what it is, isn't it? We want to guide our clients to good resources rather than, I always say to my clients, don't use Dr. Google. I am your Google. So if you want information about something, come to me, because I will pass on, the best information.
I love that, because we now live in a world that how many courses we have out there, how many programs, how many classes women are, and I'm not underestimating anyone. Look, I work with one program that I believe, but then it's just like, keep it simple.
Keep it simple, because there's so much noise out there, isn't there?
You decide to have this doula. Get the information from her.
Follow, like streamline it. Because otherwise you are literally completely, your brain just can't compute all the information. So
and it doesn't give you confidence, right?
No, it doesn't.
You're just going everywhere.
You're a bit of this, a bit of that. So that's that's an important role, but it's an honour to
be a doula. It's an honour.
So I would love to know, if a woman signs up for the Gentle Birth Method program, what will that look like?
is just signing to this amazing journey. That's what I would say. No, but it's you're gonna sign up for a program
Yeah.
that we support you in three main pillars:
Yeah.
physical support, the mental strength, and emotional support. Right. So the physical support, we will look into your diet. There are the
Okay,
diet guidelines, your lifestyle, like exercises,
Yeah.
the way you move, and some supplements, gut health.
Yeah. Okay.
Yeah, we're
very
talking
important.
about vaginal birth. We
Mhm.
all understand the importance of
Yes.
your gut health and those wonderful bacteria that are sitting there and how you contaminate your baby
Yes.
for good.
Yeah.
So Dr. Gori has, for many years, I think that's the beauty. Again, I would say how she put the Western and Eastern. We have homeopathic salt tissues that are minerals,
Yeah.
things that you will replace
Okay.
and in your body that you naturally lose. So homeopathic remedies will just dose in,
Yeah.
and this is something that Dr. Gori were capable of putting together with her wonderful homeopath doctor. Then we have the teas,
Yeah.
that, different herbs that will support your circulation, will support your digestion, will strain your uterus. And that's the knowledge how some herbs, and when you start to use those teas and those herbs to gently start to make a difference in your cervix, like we are gently preparing your cervix. When to use the amazing Ayurvedic oils. So we infuse your body with those wonderful oils that has, I don't know how many herbs. I, even with all my years working with Dr. Gori and the gentle birth, it's very difficult to pronounce and know how many herbs containing one oil. And the benefit is, I give an example, like looking at women's lifestyle, what do you work, what do you do, how do you exercise? So you recognize the tension.
Yeah.
And how do you release the tension? It's not just with the massage, specific techniques and the use of that oil that we also release the tension. So we have specific oils for back. We have a specific oils to stretch the birth canal. We have the rectum oil, when you understand the rectum and the birth canal, how close they are. So we use some rectum oils to sedate the area, to release the fascia from inside, to release the pelvis. So as you progress in pregnancy and they all experience a little bit more pressure and you are carrying more weight, we don't want you to hold tension.
Yeah, that makes
so
sense.
With some techniques, that massage technique, cranial, sacrum release, this is biomechanics as well, understanding what women's body does and how it changes and how we can adjust. So you have that beautiful pelvis. We are not perfect, are we? There is always a difference and balance. So how we can balance as your body is changing, your uterus is extending, your baby is growing, you are weighing more, but we don't normalize fluid retention. You shouldn't be really retaining fluid. So the benefits of the homeopathic tissue salt, the herbs, the supplements that she prescribed and put together to optimize women's health, to release tension, combining with those treatments. That's the physical support. Then the mental attitude through the visualization classes, that it gives you that strength. Like, what do you believe? Your fears and years and years and years and years of I say contamination because we all being brainwashed. Like childbirth and vaginal birth, it's unbearable. It's painful. Oh my God, I'm gonna die. I personally don't see any women experience that, and I'm being very realistic. There is a challenge. There is a journey. It's not easy. Then changing the language through visualization. Because if I come to you and say, "Are you in pain?" When you're in pain, let me know, because if I ask you that question, you immediately in pain, you are contracting. But if we convert the language and how do you feel? There is a body challenge, right?
Yeah.
Your uterus is contracting, your baby is descending.
Yeah.
It's pushing your baby through a birth canal that it will challenge your body.
Yeah.
But the mental strength, the attitude through the visualization, it's understanding the process, understanding the breathing, how you develop the ability of put your body into deep muscle relaxation. Actually, this is one of my favorite Dr. Goris script. We talk women into deep muscle relaxation. Your ability to put your muscles from your toes to the top of your head into deep muscle relaxation, how your body produces this wonderful endorphins, and how you connect with your body, how do you acknowledge what is happening in your body with confidence. Then you surrender, you just let your uterus contract, and you learn how to move your body in such a natural way,
intuitive way.
Yeah. So that's developing the mental strength. And then emotionally, you throughout the whole process, you're already bonding with your baby. We actually teach most of the time the couples how to do some of the treatments, that it's very simple and it's part of the program. It's part of the physical program. Abdominal toning, which is actually strengthen the placenta, the function of the placenta, improve the circulation around the pelvis is something that the husband can do every day for 10 minutes before bed. And then they are talking with their baby.
Yeah.
You create that ceremony when you are bonding with your baby. And yeah, so the journey is, you see, from the physical support, all these wonderful treatments, and the teas and the supplements and the oils, the yoga. Our yoga is micro movements. It's something that Dr. Gori and a wonderful yoga teacher many years ago, they put together. Like those micro movements will benefit you. You know, when we say like baby from 37 weeks, we start to engage in the pelvis. So we don't want the baby just engage in the pelvis. We want the baby deeper in the pelvis. So we are making women fitter for birth. So we believe in the ability that you have to give birth, but we're just going to improve.
Enhance
like you are,
that,
like we want to run a marathon. We will sign up for that program.
You're going to prepare.
Right?
Yeah.
So you're going to give birth, so you have to prepare.
Absolutely.
In so many aspects. And that's what the program does for you. And I like to say one thing, that's me saying, like, running a marathon, it's not natural, is it? Who wants to run how many kilometers? More than 23 kilometers, 40 kilometers, I don't know. But give birth is natural.
Yeah.
It's women's, you designed to do that. Imagine if you commit with the program, with that preparation that gives you a knowledge that improves your health and gives the confidence. When you learn how to surrender, how to breathe, how to move, how to release tension, how to improve your diet. That's when I say it's your lifestyle.
Yeah.
Gentle birth method, it's a lifestyle.
I love that. So tell me, Priscilla, is it only for pregnant women and their partners?
No, we at the moment, actually, here in Dubai, I think I'm currently working with 3 women that are trying to conceive. So the creative healing, the herbs, their knowledge, the visualization, because believe me or not, many women are already being told that they are not capable to conceive without having any real diagnosis. With all my respect to wonderful doctors out there that we work very close, but sometimes there are people that say, for young women, you try for 3 months, and if you don't conceive, you come back and you're implementing the mental attitude. So again, at the Gentle Birth Method, we have a program for conception, fertility. We work with women that are preparing for IVF, so improving the quality of that eggs, improving the quality of her life, improving her attitude. And also I'm perimenopausal. So there are benefits of, like when you learn the creative healing, and you learn there's the female treatment, how to restore the energy around your female organs, how to improve your digestion, what is happening in your brain, is the lifestyle as well. And the mental attitude, how you visualize, how you see yourself going through that period. So I'm always like, gentle birth method changed my life, changed my way to treat women, because it's a puzzle. That's why I keep saying it's a formal. We look in women's lifestyle, and that's when you see it's a program that we can cover all.
Yes.
For like, I have clients in the UK that their kids are 14 years old, 16 years old, and they still, coming back with like generation. Dr. Gori, oh my God, she recently delivery helped to, support someone that it was the grandchild.
Yeah, that's wonderful.
So
what a
imagine,
legacy.
Yes,
Yeah,
that's a legacy.
I love that.
Let's talk postnatal.
Yes, one of my favorite subjects.
I know. I personally am very strong with birth, where I discover my passion, but I never underestimate postnatal. And I learn a lot about postnatal with you. Everybody knows that I'm not a mother, so I also have to find my confidence as a professional. Well, I do think I'm a mother. Like a mother in many, I'm the mother of many mothers. That's what we say, right?
Yeah.
So I want you to talk about that, because I don't think it's not enough.
Not known enough.
Not known enough.
Yeah. I think you're right. It's the sort of Cinderella of doulaing. Everyone knows about birth doulas. And, the postpartum is so incredibly important. I mean, birth is obviously important.
But it's one event.
But it's, it's a day or a few days. And then you land in motherhood.
Yeah.
And to be prepared for the enormous shift that comes about when you become a mother for the first time or the fifth time. You go through something called matrescence, which is a complete brain upload. Your everything changes, and that starts actually at conception. And matrescence can last up to 7 years. So it is a process of shedding who you once were, because you will never be the person that you were before you gave birth. And birth is so important, because if that experience is positive, that's going to feed enormously into the postnatal period. Yeah. But of course, we can never guarantee what birth is going to look like. What we can guarantee to our clients is that we will hold them and respect them and hear them. So postnatal doulas are becoming much more popular. In the UK where I live, in the southeast of England, a lot of people don't have family there. They're coming from overseas or moving towards London for work. And so, they have a partner, and perhaps both of them are completely unaware of what to expect. So as a postnatal doula, some people will have an antenatal doula, birth doula, and the same doula for postnatal. There are other doulas that only offer one or the other. So a postnatal doula will get to know their clients during the pregnancy. That feels really important, because just like how, with the relationship with the birth doula, you want to build that trust. You want to understand your clients, the kind of life they live, the kind of home they have. And so we'll do a couple of sessions. We'll do a postnatal planning session where we're looking at, are you a type A? Do you have a big job? Are you used to being in control and having a schedule? How do you engage and interact with your partner? Do you share domestic duties? Do you have any help at the moment too? Do you have a cleaner? Do you have somebody that does laundry and ironing? How do you eat? Is good food important to you? Or do you eat microwave meals? Let's discuss. This is a big thing. Let's have these discussions now, because there are so many things that you can put into place.
Yes.
In order to land as softly as possible. Also thinking about the enormous pressure to have a beautiful nursery that you can show on Instagram, or the best pram, the best this, the best that, a sterilizer, a kit of bottles, and honestly, none of that is important. The most important thing is to have mentally prepared to understand normal newborn behaviour, because that can throw people so much. What? My baby fed 40 minutes ago, they want to feed again. What? My baby doesn't sleep through the night. No, this is how we live our lives until we have a baby very often. We tend to work hard during the day, and then in the evening, come home, sit with our partners, have a nice meal, maybe watch some television, see friends.
You have a routine.
We have a lovely routine. And then we go to bed and have the sleep that we need, but that's what we expect. And a baby comes along and they have no circadian rhythm. So they will need care at 3 a.m. in the same way that they need care at 3 p.m. And that is a huge shock to the system. Whether you're breastfeeding or bottle feeding, that baby needs to be cared for. Often they'll just cry for no reason. Why? What's
the way
going
they
on?
talk.
Yes, exactly. That's their language. But the first language is touch. And so we're going to explore the importance of skin to skin. And we know that an hour of skin to skin every day for the first 5 weeks has an enormous impact on that mother-baby dyad bond. So the dyad is the mother-baby, the triad is the mother-baby and the partner. So there's lots to discuss.
So as the postnatal doula, you are working with the pregnant women preparing for postnatal.
Yeah.
How do you introduce that? Because what I see, or maybe that's what I attract, because I spend most of my career preparing women for birth.
Yeah.
And even though I want to introduce the importance of preparing for postpartum, some people are very much into, but this comes first. And there's no much room for me I have to respect what she wants.
Yes.
How do we approach? How can we, let's just raise this flag now?
Yeah.
And tell everyone that as important, or maybe even more important.
Yeah.
How do you prepare pregnant couples to that postpartum?
Well, the way I do it is that it forms part of all my packages.
Yeah.
So we will have this planning session. It's going to happen. Engage, and they do. But also selecting some really good podcasts, signposting to some great books. That's your first port of call. If they don't really want to kind of sit down and plan, and keeping the sessions short and sweet, an hour and a half, 2 hours. Let's go through the key points, send them a summary of it. I've got a journal for clients to kind of work through, so they can do it quietly in their own time. But if we can have a plan for birth, we can have a postnatal plan. Mm-hmm. So who are you going to invite into your bubble? Who do you welcome in that makes you feel good, that it is going to support you in those very early days? But because some people will find that, for example, having a mother-in-law or a mother, that relationship isn't particularly good, and actually that won't make them feel relaxed, won't increase the hormones that they need for bonding. And thinking about all the other things. If they've got other children, who's going to come in and help with them, entertain toddlers, do school or nursery runs, help with pets. What we want is that mother and baby and the father or partner, if there is one, to hunker down and focus only on bonding and resting and healing. All the other stuff they can come back to. But if they haven't put a plan in place and they get home with this new baby and suddenly realise, I like to have the house tidy, it's a mess because I'm not keeping on top of it, then you find that they end up getting up and back into normal far too quickly. And it's a sacred time. It's a rite of passage, birth into that postnatal. You want to keep the lights dim. This baby's been in this watery, dark environment for
It's
around
the fourth
9.
trimester, right?
It's the 4th trimester, exactly. And the baby needs that time to adjust, and what the baby needs is their parents, their smells, to become familiar on the outside with their voices and their love and their touch. They've got their whole lives for other people to come in and be part of that support team. And they're really necessary, but they're not really necessary in the very early days. So it's about thinking hard about those people that you choose. You get to choose. And, we talk about pulling up the drawbridge. So we don't have an open policy that anyone can come and sit and expect to be looked after. No. If you want to bring a meal, brilliant. Leave it on the doorstep. Thank you so much. If you want to come in and run the Hoover around and put some laundry on, brilliant. We are so, so grateful. And we will return that favour, if you ever need us. But it's about being really clear and actually having to find your voice, because so often it's the good girl mentality, isn't it? Well, I can't tell them that they can't come because they want to meet the baby. You are now stepping into parent mode. You will be having to stand up and advocate for your child. Start doing it now. Step into your power. And hopefully that's already happened during birth.
I love that, to step into your power.
But it's important, isn't it? Actually, this doesn't serve us, and we want to conserve energy. If they're breastfeeding, they want to feel able to sit there with their top off. And, breastfeeding can be straightforward, but it can also be complicated. And the hormones of the early postpartum, you want to feel able to have a good cry and sit there half naked and not think somebody's going to come into the bedroom and, I'm going to have to talk and engage. And are you okay? Do you need tea? It's really about being selfish and claiming that time.
I don't think it's selfish, but
it isn't. But it is, and it's a real privilege to be that doula that steps in and that can sit on the bed and listen to. This is really hard. And again, not fixing it. It's hard. It's really hard, but you're doing it. Every day you're stepping through it, taking it an hour at a time. Just be in the moment. And that's what we really want to encourage. Be in the moment. Don't think, oh God, this is so hard. How long, because things do change. But you just have to know that this baby relies solely on you, and their needs can be super intense, and that can be a real shock. So again, discussing all of that newborn behaviour is important, isn't it? To kind of realize
newborn behavior. Let's talk about that. I love when I actually learn with other doulas, and in my postpartum days doulas, which I did as well. And I heard from someone, if you were the baby, if you're that newborn, what would you ask on that very moment, on that very first hour, on that very first week or month? And that question really stick with me. And make me think back of my childhood. And again, visualization, hypnosis took me there. And then I often share with my mother, think about the baby. He was like in this 10-star hotel, eating on demand, quite noisy, warm.
But muffled, not too loud or bright.
And then all of a sudden you have to breathe, you have to swallow, you have to suck, you have to deal with different temperatures and different noises.
Absolutely.
So what do you think this baby asking for?
Connection, safety, comfort. And that can all be found on the mother's chest or the father's chest, or somebody who is in that bubble.
And then how do you see understanding the newborn needs, the mother needs? Because I personally often, you as well, like women that are driven by their career, like most of our clients, they work, they are in a very good positions, their babies were their careers all their lives.
Yeah.
And they want to be able to, be on this 4th trimester bubble, but they are not necessary.
Something is calling to them.
Yeah.
So I suppose it's always working with the client and trying to facilitate the best possible environment in the way that they choose. So, if they're going to be on their laptop in their bed in that first week, because some people do, some women will start, they have their own business, it feels important. Have your baby with you, have your baby tucked in next to you. If your partner's around, make sure that he's holding baby, because their needs are so simple. They sleep so much, but very often that will be on you because they want the warmth, the heartbeat, the raising and falling of the chest. It's co-regulation. So if you're calm, your baby's calm, and that's really important because it regulates everything in that baby. So, and that's something you can talk about in the antenatal period. And of course, things might look so different when the baby arrives, because sometimes people are blown away and they're like, oh my gosh, this is the only thing that matters. And for others, they still, this is how I want to do it. I want to keep on doing little bits of work. Let's try and find times that fit with your baby when your baby is sleeping or with somebody, or as I say, that you have your baby with you, so you're able to kind of try and do both. But let's look at nutrition, let's look at you getting rest, let's look at filling your cup, some very gentle exercise, some gentle stretching those first days. Everything ideally is going to be slow because your body has been through such an intense experience of carrying a baby, birthing a baby, and then if you're breastfeeding, obviously your body's still working so hard to feed a baby, around the clock, every few hours. And there are certain times in the day where babies cluster feed, so they're going to feed a lot more, and they might be more unsettled, and that often happens at the end of the day when we're used to relaxing. So it's just, okay, we know that this might happen, that it's likely to happen. What can we put in place to support us? It might be that the doula comes in at that point to, cook a meal, to do some cleaning, to sit and listen, to put the baby in a sling, to, whatever's going to be most helpful. And with every client, that's different, because every doula is unique. There's going to be a doula for every family dynamic out there. Some people will say, I want you to train my baby to sleep. Realistically, sleep training a baby it's not healthy. We have so much evidence to support that now. So some doulas might say, I'm not the doula for you. Maybe you could look at the maternity nurse or some other form of help.
I wanted to ask a question, because I asked you about previously a birth experience or something that you have in your mind. I have one. From your postpartum days as a postnatal doula, would you share, like, what is your routine as a postnatal like? Give me one client.
So I have a client at the moment who her baby is 13 weeks now, so I'm doing my last session next week. And this has been, actually it's been really great, because this couple are incredible. The father works from home, but he is so deeply engaged in raising their son. It's a really beautiful thing to see. So they split the night, so he'll do a shift during the night. He does all the cooking. He loves cooking, he's Greek. And they, it really is shared responsibility. And very often we go in, and within a week or two that the father or partner is back at work and that mother is on her own. And it's way too soon. It's lonely. It's, you're stepping into this new role and trying to kind of understand who you are as a mother. Who is this baby? I've carried you. Now we need to get to know each other. And, that's when a doula can be invaluable, because you're stepping in and you're just, I've got you, I'm here. But with this client I've just mentioned, we go in, there's a bed in his office, so his wife sits there with the baby, feeds the baby, snoozes, they're always together, and I join them on the bed, and we chat for an hour and a half, we drink tea, just any questions that come up.
Support.
Yeah, and then I give her a lovely massage.
I love that you said massage, because that would be my next question. I have a memory, like there is a postnatal night doulas, which I did for a while. I love to do that. And as a postnatal night doula, I had this experience that I would love to share. That I had the privilege to sit with a woman in the middle of the night when she experienced like the engorgement, like her milk was really coming. And she was not comfortable, baby was crying. And for me, thinking back, the privilege of being there for that woman and trying to normalize. This is actually when she was actually panicking and uncomfortable. So I could just hold her baby when she could just massage her breast to relieve a little bit, that engorgement, to then give her the baby
so she
could just feed. And I was the whole night sitting with her, and the husband could rest. And then in the morning, like exchange shifts. So we also provide this kind of, like, as a postnatal doula, I personally don't have any breastfeeding. You are a breastfeeding counselor, which is a plus. But we do have their knowledge, and we have to have their knowledge. What to expect in terms of breastfeeding. And
I think some basics are useful, and that's covered in the Developing Doulas courses, breastfeeding. But you're right, again, sitting and bearing witness to a woman, it is so powerful, because, motherhood is messy, you're vulnerable, open, raw, and there probably aren't many people that new mother can really feel able to just let it out, and that's such a beautiful description of it, sitting, supporting quietly through the night. Night times can be very lonely for new mummies. They call it bed dread, where the whole world is asleep, and here you are trying to navigate life with a baby that might be kind of unsettled and don't know what do you need. I've just fed you. This is really hard. So that bearing witness is a key part of what we do.
I also, another thing is like the need of sitting in a group of women, that of course that whole culture when we talk about a village, and the privilege of sitting next to a woman that is breastfeeding, sitting next to another woman that is bottle feeding, or sitting next to someone that has 3 kids, and that's sharing.
Passing down the wisdom. And doulas really fall into that kind of community. We're like the wise woman of the village that would come with lots of experience and no kind of agenda, no medical elements to get in the way, just deep reassurance and support. Or just holding a hand or on the shoulder. You're doing brilliantly. You're really great. And that's what a lot of my clients say, gosh, that just reminding me that I'm doing my best, that I'm really, really, I'm here, and every day I'm stepping up. Because it can feel really hard, can't it? You just think, actually, I just want this to stop. We've made a big mistake. That's not uncommon for new parents to think, what have we done? Cheerleading our clients and really loving them.
How knowledgeable you are regarding all the postnatal treatments that we have. I mean, obvious gentle birth method. We have a wonderful postnatal program as well.
You do.
And the way I feel, actually, not just, there are benefits of receiving the postnatal treatments, which is massages and understanding that shift in women's body, and how to support through the techniques that we use that can benefit women in so many levels. Establishing breastfeeding, recovering from a C-section scar, some fluid retention that can occur,
Yeah.
the bleeding that women experience. So you are acknowledging that process, that it will happen, but support women in the emotional level. I personally, how I feel, it's the benefits of the physical support.
Yeah.
But actually, when I'm treating a woman, you are doing, you said you sit and you drink a tea with a couple and you're talking, you're supporting, you're sharing information. But you can also do this when you're treating them.
Absolutely. And with, kind of intention and positive thought. And I did creative healing training with Dr.
That's
Gori.
why I asked.
And I would say most of my clients like physical touch. I do a lot of the abdominal toning and, general massage. I also offer a kind of postnatal healing ritual when on my last session, just a sort of closing of that chapter. And it's a time for that mother to truly receive touch, because you can be very touched out with a new baby, can't you? So this is a time to receive intentional touch with love, with nice oils for her to really just breathe and have time on her own. And sometimes babies will need to be fed and they can come and tuck in too, or we stop. But yes, I think touch is critically important. So the pillars of support and nutrition, deep support with infant feeding and normalising what's going on for her and the baby, and hearing that. Sometimes the partner will pull you aside and say, can I talk to you about this? Because it's a huge shift for them. And then the kind of physical support as well. There are so many elements to what postnatal doulas do, and you can add new skills like breastfeeding counsellor, massage, but you don't need to. And being a doula is enough to just step in. I'm here.
One last thing, because we mentioned the need of the receiving. There is a pressure out there, like that culture of let's bounce back in our body. We work, of course, we have to respect, like there are models, actresses, athletes, and we support all without any judgment. But there is a culture of, I need to look beautiful again. I need to fit somewhere. How do you see those things? How do you support that? How do you talk them through that moment of,
well, there were,
it's
very
9
often,
months and transforming and transiting and becoming, and now you want all.
Again, it's drip feeding, isn't it? Managing expectations and really encouraging that first 6 weeks at least to be as slow as possible. Week in the bed, a week on the bed, 2 weeks on the sofa. If you go out, you come back and reset and rest on the sofa again, or go back to bed. So you're always focusing on getting rest where you can, getting connection with your baby where you can, because the outside world can be very overstimulating. And I think as new mothers, that can be quite a shock when they step back outside. But managing expectations around getting back into their genes, pre-pregnancy genes or something, is always little bits of information, and talking about kind of gentle introduction of gentle exercise. And I was saying, in the first days you can begin to stretch and move your body, just padding around the bedroom, and a lot of the gentle birth, a lot of Dr. Gori's program, those affirmations and breathing exercises to bring you back to your body, to just calm you. And a lot of people will wait till their 6-week check, won't they, with their doctor? But really, it takes a year. It takes a year to heal from childbirth, and far longer to integrate motherhood, into your life, I think. So managing expectations is always key.
And just for us to finish now, if let's give one very positive note for postpartum. Like, doesn't have to be. It's like acknowledging the challenge,
Absolutely.
And all this changed with respect.
Yeah, with absolute respect. But it can be and is a period that is so full of joy as I hope for most people they welcome babies with love and the start of a new chapter of their life as a family, and I think with support that really can be possible. I think having a community, having peers, having people that you can talk to, that maybe you've done your antenatal training with, your antenatal preparation with rather. So having people around you, knowing that you've got people to lean into on the hard days, because there will be hard days, but there are also going to be days that are so beautiful. And that day that your baby smiles at you for the first time, suddenly you're getting feedback. So it's huge, isn't it? Becoming a parent, becoming a mother is undoubtedly. I have 2 children, so I remember so clearly the challenges, but rising to it and the joy at watching my children grow in the relationship they have with my husband and family. So
I mean, I want to finish, but there's so many things that we can talk about. But just a quick one, because you said hopefully welcoming. We need to normalize those things. We need to tell that it's not every woman, it's not a bed of flowers. Sometimes people expecting, here is my baby, oh my God, I love. When many women out there will not say is that, oh my God, who is this weirdo?
It can really
how
really
much
take time.
It can take for you to bond with that baby.
Months, years. But equally, the minute you take your baby to your chest, for some women, they're in love. There is no right way. It's such a unique path.
It's your way.
Absolutely.
You are Zara as an individual in your journey as a mother. There is no right and wrong. We absolutely know that you're trying to do your best.
And it's drawing on everything that you've experienced in your life, your childhood, everything that's got you to that point, that how it lands, how you land in motherhood.
I love
so
that.
doulas, can make a huge difference, but also to say, most doulas are privately hired, but there are lots of charities that offer doula support for free to people that really need it, because everyone deserves a doula. It's not just for people that can afford to pay.
100%.
Yeah.
We work in the UK. I did many years of
You did.
Happy Baby community supporting women, and it was absolutely
invaluable.
My God, I'm forever grateful for those women that I support and what I learn. It's just...
And imagine how that support felt for them, to have somebody that cared.
Zara, thank you very much for sitting here and having this amazing conversation.
It's been a pleasure, Priscilla.
So looking forward to welcome more women like you that inspire women, support women. And it's such a pleasure to have you in my life. And I'm very grateful for the work that you do.
Thank you so much, Priscilla. It's been a pleasure.
Thank you.